State Chapter. So that's an association for female doctors. They come together, they help with female medical disorders. They also help mentorship programs for young women studying medicine. And Dr. Chinwe is the leader, our #1 woman at the Young Doctors Forum. And today she's here to speak to us about breast cancer. And it was, so it was important that the Nigerian medical students.
So how do you feel? I'm so happy and excited because I feel like knowledge is more profitable when it's shared.
Yeah,
and I'm happy that I'm going to share the little I know and the little I have with my delectable audience this evening. So thank you so much.
Okay, awesome. So how did your day go? I mean, the schedule of the doctor is always very, 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 very busy. So how did your day go?
My day,
Yeah.
I would say fine, but super hectic. I think I need to add that.
Very
It was a
expected.
very busy day, but
Okay.
I knew I had to be here, so I'm not gone home. So I've just been here waiting for
Thank
this.
you.
Thank you
So
for making out
basically a
time.
very busy day. Thank you.
Okay. I mean, our topic for today is one, like Rosa just said, very sensitive. It's one that has been, reoccurring in society for over a very long time now. It's the issue of breast cancer. So please, Ma, what are some common misconceptions about breast cancer that you encountered in your work?
Okay, I'm really happy that we're doing a lot of health talk these days. We're having health conversations because many of these things need to be brought to the table, and a lot of times I feel like the general public hears more from the quacks than from the professionals, and I feel that the media space needs to be saturated with the right thing. So we need to have more medical, more right stuff out there for people to hear, listen, and learn.
Okay.
So your question was the major misconceptions about breast cancer.
Okay.
Of course, there are just a lot of them, but I think I like to do things that are very relatable, especially in our sphere. Our sphere, Africa, Nigeria, very religious country. So the major misconception is not my portion.
Yeah.
It's not my portion because the major problem that we have with a lot of cancers and breast cancer being no exception is late presentation. That has been seen to be one of the factors that attribute to the high death rate and outcome and poor outcome in breast cancer patients in Nigeria and Africa as a whole. So I think one of the misconceptions is saying this is not for me, it's not possible that I can have it. So it's a spiritual thing, it's a major thing for us. It's we don't have it in my family, so I can't have it. It's a problem. It's not cancer. I don't believe it is not my portion.
Okay.
That misconception is one that really needs to be argued with. While I am not, I'm a religious person, but I also, being a science person, of course, I deal with facts, and I'm a believer that if you believe that this doesn't exist, there should be evidence that it doesn't exist, and not a mere belief that it doesn't exist. So I think that major misconception is one that we can never overflow, really. So that is the big one here.
Okay, just like you said, people say things like it is not my family. I want to ask is breast cancer hereditary?
So to say hereditary to the general public, I think I need to just say it in a way I like to talk and communicate, because if I talk without people understanding, then I haven't communicated effectively.
Okay.
Is it hereditary? Let's look at it this way: that there are genetic risk factors, meaning that if you've had someone in your family, your sister, especially first degree relatives, your sister, your mom, even your dad have breast cancer, your aunts have breast cancer, it means that your chances of having breast cancer is a lot higher, right? But of course, there are some genes that have been implicated. But then again, we also know that it's also possible for you to have breast cancer in your family and you don't have it, right? And also it's possible for you to have breast cancer and there's never been a case of breast cancer, at least that you know of. Because one of the things we know in Nigeria is that we've not really reached that stage where a lot of diseases are well diagnosed and a lot of health records. So people die a lot of times and we don't really know why they died. We don't know the cause of death. We just say, oh, they died and they were sick and they died. So, but even when obviously with every evidence, there is no documented evidence of breast cancer in your family, there's still chances that you could also have it. So it's not a It's not a 1+1 must always be 2 kind of thing. So while it increases your, so I'm answering your questions, yes, there are genetic factors that increase your chances of having breast cancer to a very large extent. But then again, you could have it without having a breast cancer, and you could have a family history and still not come down with breast cancer.
Okay, Ma, we want to know, you've spoken to us about early detection, that one of our problems in Nigeria is late presentation, and we've understood that. We also want you to talk to us about lifestyle factors that can either increase and decrease. And this is also an extension of Vine's question where he talked about misconceptions. So there are a lot of things out there, so we don't do this will cause cancer. So we want you to speak to us about certain lifestyle factors that will definitely increase your chances or decrease your chances, a person's chance of getting breast cancer.
Okay, thank you for that question. I would like to look at it as the risk factors could be modifiable, non-modifiable. Modifiable being the things we can do something about, and the things that you really don't have non-control about the non-modifiable risk factors. So the non-modifiable things like being a female, the fact that you're female increases your chances than the males, right? The fact that you've had a family history of breast cancer increases your chances, and there's really nothing you can do about it. You can't wipe out that history. The fact that you have an increasing age, of course, because breast cancer has a bimodal peak, peaking at around the 50s and around the 70s. So if your age is increasing, of course, these are risk factors that you really can't do anything about, and they exist. And the age, even if you forge your age, your real age, I'm talking about your real age, even if you forge your age and become Gen Z since 16, anyone you write on the paper, even if you have a civil service age, doesn't change. Your body knows you, yeah. So I'm talking about that real, your OG age, right? Yeah. And then of course the modifiable ones, the ones we can do about. And I want to also say there is need for a lot of research. There are a lot of things that we know, and I think that lots that we still don't know that are causing this thing. Because a lot of times, even when you review this patient critically, you might not be able to pick up one thing that you say this causes it, but we know that especially for our African community, because a lot of the books we read are for written by, yes, exactly. So other upcoming students, medical doctors should start thinking we need to do more and more research to pick out these things. So things like, can I start from what you put into your mouth, right? The diets. It said that the so-called Western diets, high in carbohydrates, especially the sweets, fast foods, that's the processed carbohydrates, high fat diet, polysaturated fat, those kind of things a lot of red meat will increase your chances. And then of course the things that are protected, the so-called Mediterranean diet, that's taking lots of whole grains, vegetables, lean meats, fish, would decrease your chances. Of course, there are other risk factors like cigarettes, like a lot of things we smoke, the young generation. And of course, you know that it's not just the first-hand smoking. Even when someone is smoking around the second-hand, third-hand smoking, shisha, cannabis, some are cooking with it and doing a lot of things. So there's just a lot. So a lot of these substances we take in the name of we're smoking, where getting ourselves could be a problem, or actually problem is right. High alcohol intake, another problem, hormonal replacement. The list goes on and on. Being fat, not exercising as much as you should, So all these things are, and then I can't not talk about what you put on your skin. The skin is the largest organ of the human body, and a lot of chemicals that are unlicensed for even human use, bleaching and whitening and glowing, are coming into our circulation. People are just taking these things, forgetting that the skin has a very large surface area, the largest organ of the human body. And when you apply this thing on the skin, it goes beyond the skin, gets into the bloodstream and basically seeds in every organ or system or cell and can result in adverse effects. So let's not forget the things we apply from. So taking drugs, some drugs, herbal medications that you don't even know their origin. You just hear that one thing from one country like that does one thing, you just start taking. So there are just a lot of things that that could increase your its chances of having breast cancer. But sometimes, and a lot of times, nothing is found as the job that just set to increase, but it's not cast in stone. Yeah, basically.
Okay, thank you very much, Dr. Chimbo. I mean, in as much as you've come with my generation about Twitter,
Yes.
you've dragged the Gen Zs twice, but it's fine.
Not
It's
really,
fine.
not really.
Okay, so can you discuss the different types of breast cancer and their respective treatments?
Okay, just like I had told her before coming here that I'm going to talk about this thing in a way that the general public will understand. Do you understand, basically? And I would say this, no, when you say breast cancer, for the general public, just know that some growths in the breast could be non-cancerous, right? They are non-cancerous. Cancerous growths, cancerous cells are the ones that grow uncontrolled and can go to other parts of the body, and not just the breast, right? And have that potential to grow in other parts of the body. So know that there are these two types of breast lesions. I think that's it. And then in terms of the breast cancer itself, we have a lot. The medullary, papillary, lobular, ductal. It's just a lot, basically. But I think what will be relevant to the top public is knowing that is rather the stages, that knowing that breast cancer can come at a stage where it's still very early breast cancer, right? That's like stage 0, 1, 2. That's when it's not like in order, it's not going to other years, the nodes and distant metastasis, and it's easier to treat, yeah, exactly. So if you come early, chances of survival are higher, and then the treatment options to achieve a cure are more available, right? Because if something, just picture that something is enclosed in this room, right? I can take this whole room away and throw it away, right? I can take this room out of Unical and throw it away without hurting Unical. And we can cope without this room, right? Now, by the time this thing leaves this room and is in the Senate quarters, in the library, in the hostels, in the, everywhere, in the auditorium, in everywhere, in the classroom, in the hostels, what do you think will happen? You really can't take it out without exactly, it becomes more difficult, right? Let's just say it that way. It becomes more difficult. And sometimes it might not really be possible easily to take it out from everywhere it has gone to. And we might lose the whole of Unical. So what we're saying is that if something is just here, when you come early, we can, treat it. We have that power to, and yeah, exactly. So its chances of survival are better. So that's the whole importance here. That coming early saves a lot. Coming early saves a lot. It just saves a lot.
Okay. One question we like to ask our guests is that if there's someone sitting at home with a certain symptom, say a lump in the breast, which is usually how people know, oh, this is when I should go to the hospital. We always want to ask, if a person goes to the University of Calabar, how can they start the process of seeing a doctor and getting help for a disease like breast cancer?
Okay, answering this question, this is like what I tell patients, right? Because I'm so big on counseling. I feel like a lot of things can be prevented, a lot of care will be better handled if people understand better. So I would like to, first of all, tell you before you leave your house, to understand that this is something you're doing for your life, right?
Yes.
So you know how you kind of literally feel that I need to eat to be alive, and you go to every extent to have food, right?
Yes.
Everybody in Nigeria is talking about the cost of living because you need to eat, right?
Yes.
You need to be alive. So I want you to prepare your mind. So I feel like the mental preparation is big. So before you leave your home, mentally be prepared that you're going to fight for your life, right? And if you are mentally prepared, it equips you with the right psychological state of mind, the right decision-making ability, the right attitude to a health-seeking attitude, right? So if you come now on the queue, you have 5 people on the queue. It's a teaching hospital. Sometimes you could have more people. It's not a hospital that is built just for you. It's for the whole state, for the whole country, for every Nigerian, right? Even expatriates can come in, right? So what I'm saying in essence is that prepare your mind that you're coming to seek care. A lot of things have been put in place to make things better. Every day, the health teaching hospital gets better to make patients enjoy a holistic atmosphere and care in the hospital. And it's a work in progress. We're not there yet, but we're better than we were. Yeah, exactly. So prepare your mind that you're coming to seek for something. It makes you open up your mind. You're more willing to tell the doctor exactly how it happened. You're more likely to listen to the doctor. If you've not prepared to listen to the doctor, if you come and the doctor is talking to you, you're going to be thinking about what your pastor said or what your village people said. I don't know whether you get my point. If you're not mentally prepared to listen to this doctor and to seek care, it's going to be like pouring water in the basket.
Yeah.
So you need to be mentally prepared. And when you come straight to the family medicine department. Really, if you have a referral, you can go to the surgical outpatient department. You can go straight there. But it's a specialty clinic, so it needs referral. If you don't have a referral to the surgical outpatient department, then go straight to the family medicine. Who see you don't need to have had a card or had contact with them. Just come in and tell them, I noticed this thing on my breast and I want evaluation. Right? They're going to evaluate you at that level. And if need be, of course, they will refer you to the necessary units that will take care of it. Of course. And of course, you're going to prepare your mind that you're going to do some tests, you're going to have clinical examination. Right? They're going to examine your breast. They might need to take some sample from your body. That's the fine needle aspiration. They might need to send you for breast ultrasound or mammography or MRI, as the case may be.
Okay.
Do you understand? So they might just prepare your mind that it might not really be. Sometimes by then you send people to the lab, they're like, oh, I just wanted you to write medicine, right? So if you're not mentally prepared, this is not a chemist. We're going to be seeing the best breed of doctors that can be gathered in anywhere, right? You're going to be seeing specialists, people who have trained right for decades, right?
Yeah.
And so there might be things they will tell you to do. And honestly, they're doing it for your own good. So you really need to open up your mind that if I need to do tests, I will do tests. If I need to do this, So you have to, so prepare your mind, yeah? And then present to the hospital. There are really people to attend to you. And don't be shy to ask questions. Stop someone, ask questions, what should I do? What should I go to? And be punctual, right? And the hospital is open up till 4 p.m. And if it's an emergency, it's 24 hours.
Okay.
There are doctors in the hospital round the clock.
Okay.
Yeah.
Okay. Let me quickly ask this. Are there any form of stereotype and stigmatization when it comes to breast cancer?
I would say yes, right?
Okay.
Because I've seen a lot of course, the answer is yes, capital yes. Let me tell a story about a young girl I once encountered who had breast cancer that was still localized to the breast. And I know at that time it was to do mastectomy, that's to cut off the breast. And the mother was management plan. I was just an intern then. And I know the consultant had told her, this is the plan we have for you.
Okay.
She disappeared. She left. What was her response? She said, my mother-in-law said, why should my son marry a girl without breast? Is he marrying a man or marrying a woman?
Okay.
And that, you understand? So that's the role of the community here, right?
Okay.
So if we would say this in the community, it comes from a place of ignorance, it comes from a place of lack of tolerance, it comes from a lot of things. Like many things are multifactorial. So we need to look at those things, you understand? But what I'm saying is that if the society provided more succor, more compassion, more tolerance, right, to people who have with these ailments, yeah. And then there's some things people do too. They'll say they have cancer in their family. Don't marry from there.
Yeah.
So if even I've seen a girl just fibroadenoma, which is not even cancerous, she just felt a lump. The guy licked, he raised out that there's cancer or there's a lump. Do you understand?
Yeah.
So these are stigmatization, but I always say the word is always better when we extend that hand that we hope to receive.
Okay.
So if you had this little lump in your breast or you were having this challenge with breast cancer, would you want everybody who comes in contact with you to live and all that? So if your daughter had that same problem, would you want her husband to say that? So the world is better when we put ourselves in each other's shoes. So it's a problem. That's a problem. And another one is the religious one. Maybe you're not praying enough. Maybe God doesn't love you. And so people will say, I declare it's not my portion, And so people will now be like, okay, so whose portion is it? Does God love me and then does it mean I don't pray well? Do you understand?
Yeah.
Some will feel it's something from my village. My uncles have come again, my aunts have come again. So the issues goes on and on and on and on. But for lack of so much time, I'm going to stop here.
Okay, thank you so much. We're going to go on a really short break. We're learning so much about breast cancer right here on the Health Hub on for one period of time. When we come back, we have really lots of things to talk about in not touch back tonight.
It's too much. How long is the break? It's too much.
1 hour.
No, how long is the break now?
Okay. 30 minutes.
30 minutes. So I can say anything I want to say.
Yes.
What do I want to say?
Your mic is off already.
I know my mic is off. I've already done like this. me that is Malian. You said I'm dragging things. I won't try dragging things. The Gen Z people, they want.
Welcome back from that break. Time check is 31 minutes past the hour of 7, and it's 6 rather, and it's still Health Hub right here on Newborn Video Father Band, only 8 station right here in the beautiful city of Calabar. And I'm sitting here with Rosette and Dr. Chinwe, and we're still discussing about breast cancer and all that it entails. So, Dr. Chinwe, let's quickly ask you this. What support resources are available for individuals and families affected by breast cancer?
Okay, thank you. There are lots of them available. Let me start with my immediate organization, where I'm the Young Doctors Forum coordinator. That's the Medical Women Association of Nigeria. We go with the slogan "Healing with the Hands of the Mother." We basically do a lot of society-based outreaches, non-paid, completely free, and we run a lot of. We look for ways to directly impact our community. And one of the things we do is free cancer screening, and we've done some support treatment for people. We've assisted some families in raising funds, and a lot of people have benefited from our care. We run our Well Women's Clinic on every Wednesday, second Wednesday of every month, as the second Wednesday in every month. And like upcoming, we are going to be having a cancer symposium at Colonel Center in Barracks Road by 10 a.m. on the 17th of April 2024. So, there are just lots of them that are coming. And there is a whole list of NGOs, Pink Africa, the Nigeria Cancer Health Fund, there's a Tinico Cancer Foundation, Cancer Aware Nigeria. There are just so many. For fear of not calling some and calling some, but there are tons and tons of cancer treatments and cancer support NGOs. They support both screening and treatment. And I always say that the earlier you come, the less cost you will need. Do you understand? And the more likely you will achieve cure. So it's still very important that patients present it early. Because when you present early, chances are higher that you get cured, right? And that's it. So present first. If you have any problem, like if you notice any problem, and that's what we talk about breast awareness. I'm sure you're still going to come to that. But knowing what your breast looks like, you notice any abnormality, anything different from the normal, please come to the hospital. And because apart from the breast self-examination, we talk about the mammogram will pick things your hand can pick. So coming early will help. If you have risk factor, your mother, your father, come, right? Your mirror again is also for you to, it's not just for your makeup, it's for you to also look at your breast every day. Exactly, is this what I know my breast to be, right? So that is very important. So it's a whole lot, but early presentation will save a lot.
Okay. So now you see a lot of these patients at the teaching hospital and also at the Well Women's Clinic, right? I want you to tell us, for persons who have relatives who have breast cancer, right? What would you say are things your patients would benefit from if their family members were doing these things? So we want you to speak to our listeners. If they know someone who has cancer, any sort of cancer, with breast cancer, emphasis on breast cancer, what do you think they should say? What do you think? How do you think they should deal with it as a family? So it's not just about, like you've said before, that this person needs support system. So what would you say? It's something you'd want families, individuals who know persons with cancer. How do you want them to treat these people, since we are doing away with stigmatization this year and beyond?
Okay, let me say this. Let me start with this, answering your question. Thank you again for the question. The first thing is, the person who is diagnosed with cancer should be open to sharing. Sharing with significant others. Because you've seen a lot of times where people come to people with, escort people to the hospital, come with relatives to the hospital, and they don't even know what the person is being treated for. Again, is the fact that the relatives coming to the hospital, apart from understanding that knowing that this person has cancer, should understand the process. Like, understand the fact that the treatment might be protracted. Do you understand? There might be different investigations. There might be repeat investigations. I always like to say it this way: what your body is today might not be what it is tomorrow. So a test you did yesterday can be asked again. It's because the body changes. The body is dynamic. You're a living human being. So things can change. So your doctor might need another test, and it's for your own good. And they might request this test. So it's understanding the process, because when you understand, you're better equipped to,
receiving this information.
Exactly, and so providing care. So when someone tells you, I've been diagnosed with breast cancer, understanding, showing empathy first of all. Don't start by, God forbid, why you talk that kind of thing. So you've already made this person, you're a child of God, it's not your portion. So you've already told this person that you must not because it's opposite now. It's not my portion as a child of God.
Yeah.
Then it's my portion as a child of Satan. Yes, that's it. So you're basically telling this person that you're not just complete in some way, right?
Yeah.
So mind your utterances, be kinder with your utterances, and it's better to be silent than to say something wrong because you might not be able to erase the effects of your word. So show empathy, listen to this person, listen and know areas that are worrisome to this person, and don't hesitate to ask, in what way can I help? In what way can I help? While somebody might want someone to talk to her, another person might not want someone to talk to her. And I always say, be sensitive. Be sensitive. That all your 5 sense organs have to be at alert. So even if somebody is saying something, look at the body language. This person looking depressed, withdrawn. That's where you come in. You can take decisions for that person. The person is lacking motivation because you need some level of motivation to seek care.
Yeah.
If there is need, learn when to ask for medical care because there is the psychological aspect to cancer patients.
Yes.
What support? So understanding this thing that this could be protracted, being ready, and then again, what ways do you support? So you're going to support with your words, support with your time, support with your finances. Do you understand?
Yes.
Support with your words, the kind of things you say to this person. Give a listening ear, time. Bring out your time, to escort this person. I can go with you. Make sacrifices. The world is better when we all come together to help one another. Make sacrifices. Okay, I'll go with you to the hospital today. I'll sit with you to the lab. Give me your blood sample. I'll submit it. And you relieve this person of a lot, and then you can support with your finances.
Yeah.
Do you understand?
Yes.
Support with your finances.
Not
If this person needs financial support and you are in a position to do that, don't keep piling things. I always say we are not exiting this world with anything. So bring it out and help this person. Help this person. Sometimes you'll be watching somebody. There's something my madam says. If this person dies now, you could bring her money for burial. That money that you have brought her for burial, bring it now. Yeah.
Very
So
true.
so help this person now. So support with all of that, with the knowledge base you have, with everything that is good in you. I said that is good in you. So if you have any bad parts, keep it. If you say something bad to this person, don't even talk at all.
Yeah.
And all that. Yeah.
Okay, thank you so
Those are
much.
little ways we can help.
Alright, at this point we're going to be opening the phone line. The number to call is 09069880789. I'll take that again, 09069880789. And send an SMS to that number or send a WhatsApp message to 080944444058 just in case you have any questions or contributions to the show. Okay, moving forward, can you talk about the emotional and psychological challenges faced by breast cancer patients and survivors?
It's a lot.
I can
It's a
imagine.
lot. So they have from mild depression to frank psychotic illness because it can be a precipitant to very severe psychotic illnesses, right? So they face a lot. Do you understand? Because life happens. You wake up today and you want to go for class. Or you wake up today, you're planning a wedding or you're planning this degree and from nowhere. Like how?
Yeah.
It changes everything. It's going to change everything because it's changing what your priorities will be.
Yeah.
The time, of course, you have to put time in the treatment. You have to spend your finances and that. So it changes a lot. And I always say something. What means something to one person might mean another thing to another person.
True.
So you've had this diagnosis. For some other person, they'll just brush it off. They just move. Another person, the next thing they'll be thinking is, I want to commit suicide.
Yes, the
So-
breakdown.
Everybody reacts to things in different ways, and we need to understand this and be sensitive to that.
Okay.
So the issues are a lot, and so beyond cancer treatment, there's also the psychological aspect and the role for the psychotherapist and the psychiatrist in management of those patients
Okay.
and support groups,
Okay.
right? Because so when you share share conversations with people who suffer the same thing with you, right?
Okay.
You're better equipped to handle it better. And sometimes you have stories and encouragement from survivors. I have doctors, many medical doctors who have suffered cancer, even in teaching hospital, and they come in every day to talk about their experiences. It encourages you, like, okay, I'm going to fight this. I'll beat you, right? I'm going to go for my care. I'm going to receive this care. I must beat you. I must, So it kind of encourages you. So I will start by saying, if you're ever diagnosed with cancer, don't isolate yourself. Don't isolate yourself. It's not the time to hide in your closet, right? We're all religious beings, or a lot of us are religious beings. So while you do that, right, and also seek for medical care and as quickly as possible, and balance and support it. When you share things, sometimes you'll be surprised that something you thought might have been such a big deal was that little. You could have mentioned to someone, maybe you were thinking of money for, let me give an example, you want to do mammogram, and then you'll be like, this woman that is always doing mammogram for 2 people, you just share it with your friend, and then she comes up with, I know this woman in my church, she does mammogram for 5 people every year. I'm not sure up to 5 people have indicated interest. Come, let me put your hand. And then you benefit from it just because you share that information. So let the victims have to be open to sharing information and holding and extending their hands so that people could actually hold on their hands and support them. And then you, when they reach out to you as the person around, be there to support them. And sometimes they might need medical care beyond, just any other care for cancer. And then, of course, know that there are lots of support groups and all that available, so they could also benefit from that.
Okay. So, we know that cancer as of today is evoking a lot of empathy, sympathy from everybody, and we understand the workload of doctors, the healthcare system is suffering a lot. Because you're dealing with people not just having medical but also psychological problems. We want to speak about people who want to help, so non-health workers who want to help. Would you just outline a way a person could volunteer with your organization or other organizations that actually work to ensuring survival of cancer patients?
I would like to talk about my immediate association because it's a worldwide association, and the Nigerian chapter, which Cross River State is under, that's the Medical Women Association of Nigeria. Cross River State branch is a very good platform for funding because it's female medical doctors, and you're not handing the money over to one person. You're handing it to an organization. You're handing it over to all the female medical doctors. That's what it means. So there's one thing I can guarantee, that the funds will be completely and appropriately utilized and channeled to the people who need care. So if you're led and you want to support people, breast cancer victims, you want to help in screening, because that will help the primary prevention in the first place. So we don't have to wait till, like we talked about the poor prognosis associated with late presentation. So if you want to start with primary prevention, you want to screen some poor women who are, over 50, some people who have suspicious masses and then they'll benefit from mammogram, or people who have family history or high indication, risk factors that make them really need a mammogram and they can't afford it. Please do well to come through the Medical Women Association of Nigeria. So the Medical Women Association of Nigeria Cross River State chapter is a good avenue to channel funds into these people. And you can actually volunteer in our programs. You can partner with us, come out for our programs and see these victims yourself and be able to impact on their lives.
Okay. So one of our last question for you for the day, except you have other things to share with us now, we want to talk about clinical trials, right? Many of the things about cancers are very tailored towards the West. So we want to know what's the degree of progress as to Nigeria in clinical trials and research. How far have we gone? Is there more to come? Just give us hope.
While I know that a lot is ongoing, I know there is a lot that needs to be done, and I know that a major deterrent is funding. Okay. The major deterrent is funding. There are lots of clinical trials in the area of breast cancer, in treatment, diagnosis, and all that. But the major deterrent is funding in Nigeria. But there is hope because Nigerians are smart. Nigerians are working. Lots of surgeons who are working day and night and researching on breast cancer. So there's a lot upcoming, and there's a lot of hope for treatment. Do you understand? Because there are now a lot of targeted therapies and all of that. So Nigeria is on the road. Of course, a lot more needs to be done, but we're getting there. There is hope.
Okay, thank you so much. I wanted to ask this girl, how expensive is the treatment of breast cancer?
So it's not a question that I can actually answer. Like it all depends on the individual. So we don't treat investigations or diagnosis. We treat the individual. Right?
Okay.
So it depends on when you're coming, where you're receiving the care.
Okay.
Is it in a private or in a tertiary facility? Do you understand? At what stage did you present? What treatment modality is being done for you? What medications are going to be used for you? What investigations do you do? So it's not a one size fits all. So it all depends on all. You can come with something that you thought was breast cancer on presentation, we realize it's not breast cancer. So it's not something, it's not cast on stone. But
Okay.
start somewhere. Start somewhere, get a card, start somewhere. Let the doctor see you and like get the ball rolling. And a day at a time. It's going to sort it gradually. We'll get to the end of it.
Awesome. I'm going to ask one last silly question. I'm sorry for this question, so I just have to ask it. I'm always very curious about it whenever I see it. Whenever there's a campaign for breast cancer, the color is always pink. Why?
I think that's what you see how you took note of that color. You see why we should have used pink. You know.
Okay.
So the major thing
I
was
see what you did there.
so you see. So thank you for noticing that it's pink. Maybe if we used green, you wouldn't have noticed
Maybe,
that.
probably.
That the green is the I don't know, but we used black. You would have, I don't know, but you see how you noticed pink.
Yeah.
I think that's the major reason why
Okay.
a lot of it, and that's the color actually.
Okay.
There is a breast cancer symbol.
Yes.
There's a symbol for cancer,
Yes.
and it's in a color pink. But it's apart from that being the symbol that represents it, don't you love the color pink? Everything.
It's kind of
Yeah.
cute.
You love pink. It's catchy, right? It drives
Very
home the
catchy,
message,
yeah.
especially because it's a problem that affects more women than men.
Okay.
Right? So
Okay.
it drives home the women. Of course, men can also be affected by breast cancer, but of course, lots more women are affected. So
Awesome. Thank you so much, Dr. Chima, for coming to educate us about breast cancer. We need to know this because breast cancer is something that is becoming a very big problem in our society today. So before we let you go, what are your last words?
my last words will be to say, first of all, thank you for having me, and
Okay.
thank you for this initiative. The Health Hub is something that it's really very, very, it's a good initiative, and I'm sure it's going to impact a lot of people, one person at a time. I always say that if one person's life is changed by something, then it's very significant. So then to the general public, my parting word would be, breast cancer is not something for the old people though. So it's in the young. It's in the young.
Yeah.
There have been diagnoses in teenagers. So, be open-minded. Do the things that will reduce your chances, and don't engage in risky practices. Don't take things that you shouldn't be taking, and don't apply things on your skin that you shouldn't be applying. And when you notice, know your breasts. Be self-aware. When you see changes that are not, normal, you notice that one side of your breast, the breast size is bigger, or you notice this swelling on one side, you notice that there's pseudo-orange, that's the dimpling, like how orange, those spots here, you notice that, or you look around your nipples, you notice that the nipple, something is looking like one eczema, skin color change around your nipple, or you notice that there is a discharge from your breast, especially when it's bloody, all those things, or you touch your armpits or your axilla and notice a lump. All those things, when you see those kind of things, please present early. Don't let the hospital, I think that would be my last line, that the hospital shouldn't be, or that should be my major line. The hospital shouldn't be the last resort, it should be the first resort. So don't come when you've gone to all those places. You're giving more time for the cancer to spread. Don't think that should have been curtailed. You've given, by the time you keep going to the native, the chemist, the church, but what you have done in other words, is giving room for this cancer to spread further. Yeah. So I would say, come early, present early. Don't wait till things are so late. And that's a major problem we have in the teaching hospital. People wait till it's so bad, that's when they come to the teaching hospital. That shouldn't be the last resort. make the hospital your first point of call. Come early and seek, be open-minded, yeah, and hopefully we'll achieve. When you come on time, you get cure for this diagnosis. That's it.
Okay, thank you so much, Dr. Chinwe. It's been an insightful conversation with you concerning breast cancer. Rosette, the last word.
Okay, I think I want to re-emphasize what Dr. Chinwe said about
Okay.
people coming to the hospital. You see, when people come to the hospital, there's a lot of rush, but you're not the only one with a problem, right? And we have the Japa wave. A lot of doctors are leaving. The doctor to patient ratio is very high. So one doctor is going to say what 100 patients is a lot. So when you come to the hospital, be relaxed.
Okay.
As far as you've presented early, a doctor will see you,
Okay.
and we would get that fixed.
Okay, awesome. Thank you so much for having this conversation with our audience. It's something that needed to be had. Breast cancer is something that it's growing. It's becoming a problem in our society today. So thank you so much for this insightful conversation. The Health Hub always comes to you every Tuesday from 6 p.m. to 7 p.m. right here on Unico 103.5 FM from the evening entertainment station right here in the beautiful city of Calabar. My name is Van Henshaw, and please do stay tuned for other insightful and amazing shows right here on the 105.
Thank you very much, Chief.